This is the first of the 4 nurse training videos. I am Erin Lisenby, Director of Nursing here with Advantage Home Care. We wanted to start by saying how excited we are to have you as a nurse with us. We want to stress how important each of our roles are to the community and to the people we care for each day. We are also excited that you want to be a part of making a difference and growing with us. Please know that if you ever need anything, don't ever hesitate to reach out to myself or your local branch. First, I want to go over a little about the website for the Home and Community-Based Services Manual. This is the website you will refer to when you need it. However, please remember you can always reach out to me or your branch with any questions. Now, there is a lot of information here, but here are the main sections. As a nurse, I would like you to be familiar with them, and we will go over the different aspects throughout your training. Client care plans will tell you the type of services the client will be receiving. Your office should tell you as well. The state deems no time limit on a nurse visit, though we want to ensure that our clients feel like they matter, as well as their medications are being handled with great care. So please stay at least 15 to 20 minutes. This ensures you are taking your time, listening to their needs, and ensuring accuracy of medications being placed in the med trays. Weekly paperwork is to be turned into the office by Monday at 9 a.m. If you are mailing in your nurse tickets, please do as soon as possible, and stay in contact with your office, as well as provide them with your schedule. Please notify your office of any changes to avoid delays in your paycheck or the billing process. Setting up the client medications each week. You will first ensure each patient has 2 medication planners. One is considered a backup planner. An example would be if the nurse usually comes every Monday and the schedule changes. The patient has the backup planner to start on, ensuring the patient will not go without their medications. Each week, make sure to switch these planners out. If there is a med change, make sure the change is made in both planners as well. A good rule to follow is if coming behind another nurse, always check the backup planner for accuracy as well. When you are finished setting up the medications, look at the medication list and count how many pills should be in each slot. For example, 4 pills in the AM slot, 2 pills in the noon slot, and 4 pills in the PM slot. Sometimes pills are tiny. For example, if the client needs 2 pills for a dosage, and you are filling the planner, you may drop one, which might not be noticed. So double checking helps you ensure accuracy and safety for our patients. Now we will be looking at and going over the nurse visit report, also known as a nurse ticket. Please turn to it in your training binder to review while we go over it. These will be completed during every visit you make. No matter what the visit is for, this paperwork will go to payroll, so make sure you get it in ASAP to make sure you get paid. Each client you see will have a nurse ticket completed. If the client is not home for a scheduled visit, you will fill out a ticket as well, writing missed visit on it. Please remember, the office will have the top information pre-filled for you. This will include the client's name, DCN number, known as the client's Medicaid number, the client's address, county, their level of care, known as LOC, and the client's priority risk. In the first area, you will write the date you are there and your time in and your time out for the completed visit. The second section is the type of visit. On the top line, you will check the appropriate type of visit. If this is the client's first visit with our company, you will check initial visit. Typically, authorized RN is checked. If you are doing a general health evaluation or GHE during your visit, you will check that as well. If it's the nurse's first visit and the client is not new to the company, please don't check this. The third section to complete is the client assessment. On the top line in the client assessment area, you will need to answer if there is an aide present during the visit, yes or no. If you answered yes, then write their name. Then make sure to have them sign the bottom on the aide signature line. If the aide is with another company, they will not sign our tickets. Then begin checking the appropriate places for your assessment. Nurse comments. This is where you will document all you can. Please document the client's lung sounds, their upcoming doctor's appointments, their pain level, last bowel movement, any med changes, as well as if there is any other information you feel that might be pertinent to the visit or their care. If you feel you have a lot to say and not enough room, please flip the ticket over and document on the back side. The fourth section to complete is the nursing services delivered. This is where you will mark why you are there, what you are doing, such as med setup, nail care, skin monitoring, Evaluating Advanced Personal Care, or APC. You will check whichever service you are rendering. If it's an injection, write that in Other. The fifth section is the last 4 questions to be completed on the nurse ticket. The first 3 questions will be answered by the client. The 4th question is about the GHE 6-month report. And if a GHE report was done during the visit, please turn it in with your nurse ticket. This will be sent to DHSS by your office. Lastly, make sure you and the client sign and date the ticket. Reminder: if there is a missing signature, the branch cannot send the paperwork to payroll or billing for this visit. If you go for a scheduled visit and the client is not home, then use a nurse ticket. Date it for that day. Then in the nurse comment section, write why the visit was missed. Reasons such as client wasn't home, client is in the hospital, client is out of town. Lastly, please remember to turn all paperwork into the office in a timely manner.